Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to go over the recumbent bike, some of the benefits, and some ways to use it after knee replacement surgery. Before I jump into that, be sure to hit the subscribe button, turn on the notifications so you can catch all of our latest videos. Recumbent bike is called a recumbent bike because it has a backrest and what you would think of kind of a normal seat instead of the kind of bike seat or that upright position where you're flexed forward like a typical bike. Usually this is a lot more tolerable for folks, especially early on after surgery. A lot of great benefits of the recumbent bike, a great low intensity form of aerobic exercise, a great way to work on your knee bending and straightening, work on your range of motion, a great option for a warm-up or a cool-down before your exercise or therapy sessions, and just a great way for muscle re-education and muscle patterning. So working on a particular frequency or a particular speed with the bike and with the cycling to start to get that carryover when you're trying to improve your cadence, improve your walking speed when you're upright and walking. So a lot of different great benefits. For using the recumbent bike, first things first is definitely safety, getting on and off the machine. Be aware of whatever things you might have in the middle here, frames of the machine. If it is a chair that twists to the side, definitely get in on the side and then rotate the chair once you're sitting. That's a lot safer. This chair doesn't rotate, but what I would do is just back it up all the way, comfortably and safely get in and sit down, and then use the machine. For just general positioning, and this is folks with knee replacement or otherwise, is typically you want to think about when your leg is out all the way straight, either one, you want it to be at a spot where it's not necessarily locked out straight, your knee, but there's just a little bit of bend left. So that's usually what I think of as my seat position, just when normally using the recumbent bike. So what I'd do is get my feet into the position, into the pedals, then I'd move myself up to the appropriate seat position, and then early on after surgery, we don't have to do these straight, full forward revolutions. There's a couple different things you can do. So you can do the rocking. You can do the rocking with the leg kind of in this back position closer to the body, just going up, going down, up, down. And then there's also where the leg is a little bit farther out and doing the rocking from that position. So one leg is closer to the body, one leg's a little bit further from the body, and you're doing that rocking. So you can do both with the surgical leg as the further one from the body, and then you can come and do with the surgical leg closer to the body. So that's a great option, especially early on, when those full revolutions may really be uncomfortable, difficult to tolerate. Also, there's sometimes folks who might do that rocking just for the first minute or two until the knee starts to warm up a little bit, and then go into those full revolutions. Another great thing, you can do the normal forward revolutions like you're riding a bike, and you can also do backward revolutions. There's a lot of times where people, for whatever reason, tolerate the backward revolutions better than going forward. And I say go ahead, that's perfectly okay. You're still getting that bending, straightening range of motion work, you're still getting the blood flow, you're still getting the aerobic exercise. So go ahead, if that's more tolerable, do the backward revolutions instead. A lot of times, once people start to build up some tolerance, build up some mobility, I'll usually say do half of your time doing forward revolutions, do half your time doing backward revolutions. And that just gives some different inputs to the legs and the knees, helping to build some motor education with moving the knees and moving the body. A couple other things, and one of the best things I like about the recumbent bike is you can track your progress. And the way you do that is just looking at the seat position and what seat position you can tolerate. The further back you're sitting, the less you have to bend and flex the knee as you're pedaling. the closer you're sitting, the more bending and flexion you need from that knee. So early on, you're probably going to be sitting a little bit farther back. As you start to build up your mobility, your range of motion, we can start to track our progress moving that seat forward. So for example, if you start the first session at seat position 6, then the next session you might scoot it up one notch, try seat position 5 for the 10 minutes or 15 minutes, whatever it may be that you're on the bike. Moving up to seat position 4, 3, 2, 1, until essentially you're as close as you can possibly get. There's no significant issues or concerns getting up real close. The only thing I tell people is, if you're up really close, really tight, think about if it causes any pain or discomfort. Sometimes you might get a little bit discomfort in the hips. So in that case, I would say back it up just a little bit. You might get just some compromised movements, some compensations. So we still want to have good technique, even though we are up and getting our knees high and really bending the knees. But otherwise, it's perfectly okay to scoot that chair up nice and close and really work on that bending range of motion. So those are just a couple of the benefits and a couple of the great ways to use the recumbent bike after knee replacement surgery. I hope you found this video helpful and insightful. Please be sure to hit that like button if you did. Please be sure to leave your questions, your comments below. I do my best to get back to everyone I see. Again, thank you very much for watching.